Everyone, welcome to the Sentencing Project's webinar on the Public Health and Public Safety Foundation for Broad Prison Depopulation in a Pandemic. I'm Nazgol Ghandnoosh, a senior research analyst at the Sentencing Project, and I'll be moderating this discussion with my colleague, Morgan McLeod, who's our communications director. From the beginning of this pandemic, we've heard from medical and public health experts that prisons, jails, and immigration detention centers should be depopulated to mitigate the spread of the virus. These are overcrowded and unsanitary settings where social distancing is often impossible. Advocates have amplified these calls for urgent decarceration, and some lawmakers and correctional leaders have responded. The typical jail in the United States has reduced incarceration levels by about 30% since the start of the pandemic, leaving still a long way to go. Immigration and Customs Enforcement has reduced admissions to its immigration detention centers, though it hasn't released a substantial number of people in its custody. But we have yet to see meaningful decarceration in US prisons in response to the pandemic. As expected, the virus has been spreading in prisons, jails, and detention centers based on national data gathered by the Marshall Project, the UCLA COVID-19 Behind Bars Data Project, and other sources, including juvenile justice figures compiled by my colleague Josh Rovner. Limited testing at most of these facilities constrains our understanding of the spread of the virus. Our three panelists today will discuss the public health and public safety foundations for broad prison decarceration during this crisis, including for people with serious and violent convictions. They'll also describe their efforts to align correctional policies with the demands of the pandemic. The panelists are Dr. Carlos Franco, Associate Professor of Medicine-Infectious Disease at University of Colorado, Professor Sonja Starr, Henry M. Butzel, Professor of Law at the University of Michigan, and Mr. Sam Lewis, who will be joining us shortly, Executive Director of the Anti-Recidivism Coalition in California. Please feel free to submit your questions at any time, and we'll discuss them after the presentations. Before turning it over to the panelists, I want to say a few words about how this discussion fits with our ongoing work at the Sentencing Project. Overall, the US prison population has declined by 9% between 2009 and 2018, based on the most recent federal reports. Prison Policy Initiative and the Vera Institute of Justice have examined more recent trends, including during the pandemic, and they've found only modest reductions since then. This chart shows that most of the downsizing in the prison population has occurred among people with non-violent convictions. Specifically, the number of people with a drug conviction has declined by 29% since it reached its peak level in 2007. The number of people with a property offense conviction has declined by 18% since that same year. But the number of people convicted of a violent crime has only declined by 2% within the prison population since 2009. Reducing prison admissions and prison terms for people with violent convictions was significant and important before the pandemic, and it remains so now for a few reasons. First, half of the people in prison in the United States is serving time for a violent crime. So that includes crimes such as assault and robbery, and the most serious crimes such as rape and murder. So scaling back prison terms for this population is critical if we want to make a dent in the number of people in prison. Second, most people in prison for violent crimes, many people in prison for violent crimes are now non-violent people. They have aged out of crime. Their maturation and brain development make them unlikely to make the same decisions that they made in their late teens and early 20s that landed them in prison. Their continued imprisonment is not an effective deterrent for others, and it wastes tax dollars that could be more effectively invested to promote public safety. And regarding public safety, it's important to note that crime rates have fallen to half of their 1990s peak levels in the United States. Like many other countries, crime rates began to increase in the United States starting in the 1970s and then began falling precipitously starting in the 1990s. But the United States is exceptional in dramatically increasing prison population levels starting in the 1970s. And that's something that we've only just begun to undo. A key part of understanding mass incarceration in the United States is grasping the scale of life imprisonment. The most recent count has revealed that 1 in 7 people in US prisons is serving a life sentence. Over the past year and a half, the Sentencing Project has had a campaign to end life imprisonment. Based on criminological evidence that life sentences are counterproductive to public safety and put upward pressure on other sentences, we recommend limiting prison sentences to 20 years. This is a picture of a group of people from Maryland that were serving life sentences and that were released as a result of the Unger versus Maryland court case in 2012, which enabled them to bypass the roadblocks in the state's parole process. Of the nearly 200 people released as a result of this court case, only 5 have returned to prison for a violation of parole rules or for a new crime, well below the state's overall recidivism rate. Notice from this picture, most of these people are men, most are elderly, and they're overwhelmingly African American. People of color are overrepresented in US prisons and jails. They make up nearly 2/3 of the incarcerated population. African Americans alone make up 1/3 of the US jail and prison population. My colleague Ashley Nellis has shown that this disparity is even worse among people serving life sentences. Nationally, half of the population serving a life sentence is African American, and in some states like Maryland, that proportion is 3/4. While white Americans increasingly understand the need for a public health approach to substance use problems, their distance from the conditions that promote crime, violent crime, and from people serving sentences for these crimes poses an obstacle to scaling back excessive prison terms across the board. And so it's especially important to educate the public and policymakers and practitioners about the medical and criminological evidence supporting broad decarceration during a pandemic. And with that, I'm going to turn it over to Dr. Franco.
Thank you, Nazgol. Can you see the presentation now?
Yes.
Yeah. Okay, well, thank you. And thank you for the invitation and the opportunity to give my perspective on. I'm an infectious disease physician with a public health degree. That over the last few weeks have been very intense and very, very meaningful to give you my perspective, which I'll try to do in a concise and hopefully also meaningful way. And thank you for my colleagues, Sonja and everyone involved. So, you know, I think we should think about these as, you know, Professor McNeil from the University of Chicago, he wrote a book called Plagues and People, who was partly the seminal work for subsequent, you know, understanding of how the impact of infectious diseases in terms of how they act usually as the wild cards of history and how they have played a significant role in the establishment of human societies. And, you know, what we see in this slide is basically what is called the 4 epidemiologic transitions that, you know, humanity have gone through about 12,000 years ago till now. And all of them, if you see here, the common theme is usually population migration, as well as conglomerate settings of populations in villages, cities, urban establishments, reaching a population density that allows for the transmission of some of these infections that require that human behavior from infectious agents passing from person to person. You know, and the most, I think in my opinion, one of the most historical, I would say, books in literature and also in the science of infectious diseases is actually Albert Camus' The Plague, which I know it's, you know, now revised and being discussed in different opinion pieces and so on. I myself participated in one, which is where I would like to start this discussion, and it's the fact that, you know, the main character of this textbook, which is considered one of the best novels in the post Second World War era, is the story of these bubonic plague epidemic in the town of Oran in the coast of Algeria, where this main character of the book, Dr. Bernard Rieu, talks about how he talks about decency. I think here to me, the word decency is very significant as a physician, as a healthcare worker, and now understanding a little bit better what happens inside jails and prisons in the US and elsewhere. And I think it is our role as medical practitioners, as physicians, nurses, or anyone involved in this type of discipline to look after the most vulnerable people. And that's why I like these stories, because of decency. And I'll go back to this topic in a second. So based on this and my previous involvement with developing, along with a group of many people, a pandemic influenza preparedness guidelines for the World Health Organization and other types of documents with governments, I decided to put together some advocacy letters to different public health leaders, and as well as correctional leaders, to the Immigration Customs Enforcement Agency to promote the release of or decarceration or release from detention centers of individuals because of the concerns that the COVID-19 pandemic was offering back in February, early March, from the experience in China, and at that point, basically in Europe, in Italy, France, Germany, and so on. And from there, some of these letters reached some of the civil rights attorneys and advocacy groups, and I was invited to participate in the inspection of some of these jails, as well as hearings with judges and so on, and writing declarations for different settings, particularly county jails as well as some state prisons. If we focus on the pandemic now, basically we can talk about 3 waves epidemiologically of transmission, overlapping, not that they're very distinct. But the first wave, if we focus on the US specifically, is that we see that there's this initially non-sustained transmission in some of the communities, but it actually reached these conglomerate settings of nursing homes, long-term care facilities, skilled nursing facilities, and places that had many people confined in a closed environment. The second wave, which is early March to the present time, because again, these are overlapping waves, involves sustained community transmission in large urban settings, and began in the Pacific Northwest, in the southern state like Louisiana, but we know particularly of the Northeast Shore how impacted New York City and other surrounding areas. And then the third wave, which is what brings us to today's discussion, is basically what's happening in jails and prisons and detention centers in the US, where they have become the epicenter or the hotbed of transmission of the pandemic in the US. So this brings me to one question that very I would say clear-minded detainee in one of these jails asked me, and he said, is getting COVID-19 and dying from it part of the package of being incarcerated? And that was the reason, because one of his cellmates, cellies, as they say, died from this infection. And he described how he was basically a gentleman who was on a parole violation, and didn't have that $200 for the bail bond, and basically died when he was elderly, but he was otherwise pretty healthy. So this really, I think, pinpoints the fact that one thing is public health, and public health here is public safety, and public health in a jail is also public health in a community. And it became very clear to me after this question and subsequent discussions and interviews how everything is connected. It's not that it's just the medical facts and so on, but this was a very eye-opening experience. So as Nazgol presented, and I'm not going to go into detail except for a few considerations in this table, is that the number of people, whatever database you use except the CDC, because for some reason that I would like not to sound negative. They're really behind in responding to the correctional facilities outbreaks. Is that the thing is that these numbers are continuously growing. And one of the things I would like to tell you is, number one, there is a significant problem that we know. Number two is that there's many people that are dying. And this is the important part that I would like to at least share with you is we can conclude that these deaths are preventable. You know, these are preventable deaths that have been largely ignored in many of these places, and that is quite upsetting to talk about them. And then also that the driver of transmission of these outbreaks are usually the staff bringing infections from the community, and I have witnessed in every single of these inspections that the basically the vector or the index case is among correctional officers, and there's been, as we can see here, deaths associated with that. So again, just in summary, the exponential problem, despite the fact that there's under testing and under reporting. The second point is, again, that's preventable, and I think this brings us to the fact that there's these basically, as in the movie, one of the Batman movies that I watched with my two sons, is that there's something about structures are shackles, man, and these shackles are inside jails and prisons, but they're also outside jails and prisons. And it's not a coincidence that we see that the highest impact of the COVID-19 pandemic in correctional settings, as well as in the larger communities, have affected the same populations, though. And I think this brings us closer to the fact that there are similar themes, and it's usually again, it's not hypertension, diabetes. Those are important factors, but those are symptoms of a larger problem, which are structural vulnerabilities that people are shackled. Some people are shackled to these vulnerabilities since the time they're born, basically. And that's why I learned throughout my interviews of many of these inmates or detainees or prisoners or offenders but more importantly, human beings. So I'm not going to go into more detail because Nazgol already talked about these, but one of the important things to mention is that inside prisons, particularly those people that are usually sentenced for more than a year, there is medically, and this is accepted even by the Justice Department, that there's an accelerated aging. So if we talk about 65 years of age as a risk factor for complications associated with COVID-19, that implies 55 years of age for people inside prisons and jails. But then also there's conditions such as HIV, hepatitis C, that causes liver disease and potentially chronic kidney disease as well, that are 5 times as frequent inside these correctional facilities as they're in the larger community. And so the same with diabetes and COPD and other conditions that places these individuals at risk of these complications. So is the overcrowding, is the lack of sanitation, is the poor medical care that these people receive, but it's also this aging factor, and it's also this high frequency or high prevalence of medical conditions. In addition to that, this infection is unique, and there's transmission compared to influenza. For example, there's been outbreaks of influenza historically, like the San Quentin impact in the 1918-1919 pandemic that caused many deaths in the US in this correctional facility, or many other examples. However, what is different here is that this infection, this virus is the master of disguise from a pathological perspective. It's able to be transmitted during these pre-symptomatic stages, during asymptomatic individuals, which could be up to 50, 80% in some of the series. So it finds a way to reach or to continue to be transmitted or become infectious. And the concern here is when it reaches somebody who's like the person I talked to earlier who died. I talked about him earlier who died because he was 74, and which means he was basically 84 in the scale that we discussed about. So, and again, the issue about, officers going back and forth, and then the new inmates. New inmates may offer also a significant risk of introductions, even a significant revolving doors of jails and prisons. The basic reproductive rate or basic reproductive number of an infection is how many secondary cases are from a case. And this number has varied from, in different studies, from 2 to 5.6. The point here is that number is important, but what is important is that it's higher than influenza 1918, 1919, which was particularly devastating. But the other thing that I would like to pinpoint to you here is that there's this host, in this case, humans and pathogen perspective, but that the frequency of contacts is a very important factor in this equation. And what that means is basically, how is the frequency of exposure, and the more frequent exposure you have, like in a closed environment, like a jail or a prison or a detention center, similar to what happened in the Princess Diamond cruise experience, the spread of these infections is basically fast and furious. So the point being, this could be by playing cards, playing dominoes, sharing the same table, and so on. And it's also because there's not insufficient soap in most of these facilities, or inadequate practices. When they use the telephone to call their families, telephones are basically shoulder to shoulder. So the point being, the opportunity for frequency of transmission is really high. So just the final few slides. What is that I have learned and I would like to share? And again, this is what I've learned. And at the end, I'll talk about some of the sources that I've used, and I'm speaking for many people here. But is that we're dealing with a very severe pandemic of a viral pathogen that is very unique, that is a master of disguise, that can be transmitted by asymptomatic people, by pre-symptomatic people, and that it's different than what we've seen before, and we have to adapt and we have to learn. And some of the lessons learned from previous pandemics are relevant, but we also have to be bold and brave and use basically common sense. Common sense is cheap, in my opinion, and we sometimes, for some reason, prefer the most expensive neoliberal approaches for vaccines, medications, instead of using what we are seeing. So the second part of these COVID-19 best practices is that depopulating jails is the most and the only way, in my opinion, to achieve meaningful social distancing. There's no other way, and the question is, to what level? To what level would be, I think it's a question I hear from the attorneys often. When do you stop depopulating? When do you reach a level that is acceptable? And I believe that level is when you're able to, if you can release any more people, to be able to single cell those at the highest risk of dying from this infection. The second and the most important thing too is always the number one issue should be protecting the medically vulnerable, because as I experienced, for example, in Prince George's County Jail, is that they had a large outbreak, but nobody died. And nobody died likely because they were all, most of those affected, they were younger than 55, and most of them are actually younger than 40. So the age factor is important, the medical risk factors are important too. So protecting the most medically vulnerable are very important. The last 2 minutes is insufficiency of the CDC guidance. I'm not going to go into more detail except to say that the symptom screen that the CDC recommends in their guidance, even as of today, and the temperature check they used, they have not only failed to protect these individuals, in my opinion, and I have enough proof in these declarations, discussions with judges and so on, to say that we need to be doing more testing. Without testing, we will continue to manage these blindly, and it will give us inefficient information for action. So testing should be the way to promote population management for isolation, quarantining, and sequestering those new inmates or new detainees that are going to these places. And just to finalize, decency, to me, I started with this and I like to finish. Decency means, it's not about medications or vaccines. It means addressing the social factors, the health inequities that are inside and outside these jails, and that the medical community should be involved, and we need to work with attorneys, with social workers, with everyone, and this should be part of of our training and our I would say our discussions from now on, particularly now that COVID-19 has unveiled significant structural vulnerabilities of minorities and populations inside jails and outside jails too. and protect the medically vulnerable. And one thing I try every day, and this is not about me, I mean it in the most honest way, is we have to share the stories of these people, because I never seen fear the way I've seen it inside these places. People that are extremely afraid, they fear for their life, and they're not asking for anything but just to have soap, basic protection that some of these places are not offering. So with that, I would just like to leave you these from my friend Alec, who I met recently and I've been discussing with his email. We need a different narrative. We need a different narrative. We need not to let some people erase the stories of some of these people. And I think the way forward is not, as I said, medications or vaccines, but addressing the structural inequities that may improve also health outcomes. And anyway, thank you so much, Nazgol. I hope I didn't go beyond my time.
That was really great, Carlos. Thank you very much. And welcome, Sam Lewis. We're glad that you were able to join us. So next, we're going to turn it over to Sonja Starr.
Thanks, Nazgol, and thanks, Carlos, for those great remarks. I am going to start, so I'm going to focus most of my remarks on my research on crime rates after people are released, because that addresses, I think, one of the public safety objections that people raise to COVID-related prison releases. I do want to spend a few minutes talking about the COVID crisis in jail and prisons. I think that Carlos gave you the basic epidemiological picture, right? And one point I want to emphasize is that there's a lot of people in our society who don't really care about the lives of prisoners. I think that that is, a callous way to think about other human lives. But I do think that as we make this public health argument to policymakers, it is important to emphasize that it is not merely the lives of people in prison and jail that are at risk, but that controlling the COVID outbreak in prisons and jails is really important to controlling it in our society at large, and getting a handle on the pandemic and allowing our society to move back toward normalcy, right? That's because jails and prisons are not isolated from the rest of society. If they were, then we wouldn't have to worry about COVID getting into them, and we wouldn't have to worry about COVID getting out of them. But in fact, jails and prisons have lots of entry points and they have lots of exit points. The most obvious are the staff, hundreds of thousands of them in the United States, who come and go every day and can bring diseases from and to their family members and everyone else that they interact with. And that, I think, right now, in the last couple of months, most of those staff members have been living under stay-at-home orders, right? So they are themselves at lower risk when they are in the community. They're not going out to bars and restaurants, et cetera, and then bringing that into the prison. As those things start to lift, I think we're going to see things get worse, because the people who are coming in to the facilities on a regular basis will be at higher risk of bringing something in. I think we will see the numbers that Carlos showed you skyrocket once we start seeing, so what's happening now basically is that the aggregate rates, which Carlos is showing you, those first of all, of course, are going to be underreported, because if you think it's hard to get a test as a normal civilian, try doing it as a prisoner. But also they're concentrated in some facilities and not others. So some have not yet been hit by outbreaks, and it's not too late to prevent those facilities from being subject to outbreaks. But the facilities that it has hit, COVID has spread rapidly through. For instance, there was an Arkansas facility, as an example, in which I think, within a few days or a week or something of the first case, something like, I can't remember exactly what it was, maybe 80% or something of the inmates tested positive, and the staff are testing positive too, right? And are also at great risk. And so staff and people who are released, because people are released all the time, regardless of whether they're released early. A lot of people are scheduled to be released during this, this pandemic. So staff and releasees will take it home. And also prisoners are gonna have to be transferred to local hospitals for treatment, which could quickly overwhelm hospital facilities, particularly in the smaller rural communities where many prison and jail facilities are. So I see this as a huge public health challenge, as well as a moral test for our society, right? We are kind of used to not caring about the well-being of people in prisons and jails. And there's, I think, a real question: can we break out of that pattern of indifference to the lives of people behind bars, even when our own lives depend on it? Or are we so attached to the practice of punitiveness that we can't even protect ourselves? There are some things that legally that governors especially, and certainly legislatures, and to some extent corrections officials and courts have the power to do, right? Governors have emergency powers that are allowing them to do quite remarkable things regarding the rest of the population, like ordering us to stay at home. They also have the power to invoke those emergency powers to take steps to protect people within prisons and jails. Most important things are putting fewer people in and taking people out. And those things can hopefully buy some space so that whoever we have to confine in jails and prisons, we can do in safer conditions, like single celling people instead of having them in double or triple cells, for example. So putting fewer people in means things like postponing sentencings till after the pandemics. Stopping the practice of confining people for failing to pay bail, which is a moral atrocity in general, but is even more appalling under these conditions. Not incarcerating people for routine technical violations of probation and parole. And then taking people out doesn't necessarily mean completely ending their sentence, right? It could mean transferring them to home confinement for the duration of the pandemic. You know, home confinement is a thing that can protect the community, and you can use things like electronic monitors, et cetera. So the options are not just leave people where they are or completely terminate their sentences. And I think priorities here should be older people and medically vulnerable people, people who are already scheduled to get out in the next year, who will be, you know, who we're going to be dealing with their release during the pandemic anyway, so we might as well worry about it before they have contracted the coronavirus. And then you know, I think the lower hanging fruit is people who are there on technical violations or failure to pay bail, or, you know, nonviolent crimes that that really shouldn't have resulted in incarceration in the first place. But we do need to talk about people who are there for violent crime convictions too. And that's what I'm going to focus most of my talk on. And why aren't we taking all these steps? You know, I think basically because people are afraid of what prisoners might do if they are released, right? We have this sense of dangerousness attaching to people who are behind bars. And so that's what I'm going to focus the rest of my remarks on, which is what the research on criminal recidivism of people who are released actually tells us. Okay, the research that I'm going to talk about is co-authored by my colleague J.J. Prescott and our student who's an econ PhD student, as well as a law student, Ben Pyle. And we, it's a paper on violent crime recidivism. So we're looking at what all the statistics can tell us about the rate at which people commit new crimes, and particularly new violent crimes, after they are released after serving a sentence or part of a sentence for an underlying violent crime. So why do we focus on violent crime? Well, violent people who are there on violent crime convictions are a majority of state prisoners. It's actually fewer than 1/3 of new prison admissions, and even lower as a share of jail admissions. But the sentences are so much longer, and there's a longer time served as a percentage of the sentence because of restrictions on parole and early release policies. That people just end up being behind bars for a lot longer. And as a share of older prisoners, which is particularly relevant in the moment of this COVID crisis, this is even higher. So in 2013, which is the latest aggregate number that I've seen, approximately 2 out of every 3 state prisoners over the age of 55 was incarcerated on a violent offense. Half of all state prisoners over the age of 55 were imprisoned for the crimes of rape or homicide alone. And so we can't really talk about effectively protecting older prisoners from COVID without being able to talk about whether we should take steps to protect people that have violent offense convictions, including serious violent offense convictions. And the reason that so many of the older prisoners it's not because they have committed the crimes when they were older. Most of them committed the crimes a really long time ago, and they have been behind bars for decades. And so I think it's important to ask not just, were they a dangerous person when they committed the crime in question? The answer to that will often be yes, assuming they were rightfully convicted of the crime. But are they dangerous now? And so we look at the research on that, and we basically do 2 things. We review kind of comprehensively and critically the existing studies of this question that are out there, and then we also offer our own research. Our own research is based on corrections data, the National Corrections Reporting Program. And so what we're looking at is people in state prisons, not jails, and people who are released, and then we also look at readmission rates. And both when we're looking at our own study or at our own data, and when we're looking at everyone else's research. An important thing to note is that it's all focused on criminal recidivism rates in normal times, not in a time when people are likely to be transferred into home confinement during a pandemic, right? So anything that we could anticipate happening as a result of prison releases that are conditioned on staying at home, we would imagine that in that situation, crime rates would be lower. Crime rates in society in general have been quite low in the last couple of months, as it's harder. Most crimes you don't commit at home. Our own research is based on a larger sample than most previous ones. It's a total of about 1.1 million individuals released from state prisons, including hundreds of thousands of people with violent crime records. We in particular were focused on violent crime reoffense rates. That is, we're looking at people with violent crime records and the extent to which they commit new violent crimes, because we think that is the thing that people are the most worried about when they talk about public safety concerns, right? They're not so concerned that the person convicted of an assault 20 years ago is going to be released and cheat on their tax returns or something. They're focused on the violent crime to violent crime cycle, right? So even though we've got what we think is a bigger and richer data set, we basically confirm what other studies have found. The literature is pretty consistent on this, that overall reoffense rates are actually lower for people who are released after having a past violent crime than for people with other offenses. If you look specifically at violent recidivism rates. Then, in fairness, the rates are slightly higher for people with a violent crime on their records. But in absolute terms, they are very low, with the possible exception of people who are released at quite young ages. So a key upshot of our research and the body of research as a whole is that recidivism rates are hugely dependent on age. What we find in our data set is that overall reincarceration rates for all people with a violent offense who are released from prison are 9%. That's a 3-year reincarceration rate. So within 3 years, 9% of everyone who's released from state prison with a violent, whose original sentence was on a violent offense, will be reincarcerated for any new offense. For people who are age 55 and over, that same figure is under 1%. And the rate of people age 55 and over who have a past violent offense then ending up with a new violent offense in the next 3 years is less than half of 1%, right? So 99.5% that's not happening. And so the vast majority of older prisoners, when you release them, are turning out to be quite low risk. And that's important, I think, for the question of, like, do we need to exclude violent prisoners from these programs that are meant to help people who are at high risk of COVID be protected from it? And I think the answer is no. There may be a few exceptions. You might have to review cases to identify if they're like particularly dangerous people, especially maybe people who committed their crimes recently in the first place. But for the most part, the risk is extremely low. Now, those numbers are lower than what you may have seen elsewhere, right? So you might have in your head things saying, oh, 2/3 of people commit new crimes in the first year or two. Though that is partly because we are using a pretty narrow measure of what recidivism is. It's re-imprisonment on a new offense. So that means we're not including arrests that lead to no charges or to dropped charges. We're not including technical violations of parole. We're not including anything that does not lead to a subsequent prison sentence. And this is because of the nature of our data, right? We're using corrections data. And so what we see in the data is people who move in and out of prison. We don't see other kinds of outcomes. And so I think you could criticize us for being under-inclusive as a measure of all recidivism. On the other hand, I think most of the numbers you see are over-inclusive, because I don't think we should count a wrongful arrest, for instance, that leads to dropped charges as recidivism, and counting things like failing to meet your parole officer when you said you would as a new crime. That's not a public safety risk that the public is really concerned about. And most of all, I think we don't think the way that we count it is very under-inclusive as to the things that policymakers are most worried about, which is serious violent crime. So if you get caught for committing a new violent crime and you have a prior record of violent crime that got you incarcerated, and there's evidence that you actually committed the new violent crime, you are overwhelmingly likely to go back to prison for that new violent crime, and it's not going to be handled. If it's at all serious, it's not going to be handled as a technical violation, and you're not going to just get probation for it. And so we don't think that we are under-inclusive as to the real public health risks. So I'm not saying there is zero risk, but there's never going to be zero risk in any population that you look at for committing a crime. And in this context, we have to be weighing whatever risks exist, which I think are pretty low, against a big risk to people who are incarcerated themselves, as well as to the people who work there and their families and surrounding communities and our society as a whole as we attempt to control the pandemic. Okay, that's it.
Thank you very much for that. Okay, and now we will turn it over to Sam Lewis.
Hey, Nazgol. Sam sent a message that he's testifying right now. Has he said that he's returned yet?
Oh, I
He
missed
might
that.
not have
So
returned
do you
yet.
think? I see.
We can just go ahead
So
and
should
open
we
it up
cover
for
some
questioning
questions?
right now. Yeah, I think that's great. Because we've already got a lot of questions coming in, and then whenever Sam can join us, we'll let him just jump right back in. But so going off of just Sonja's presentation, there's definitely a couple of questions for you. Does the recidivism rate of older incarcerated people? Oh, Sam might be back. Sam, are you ready to go?
Yes, I sincerely apologize.
It's okay.
Literally, the Senate hearing is going on right now. The Senate bill that I just testified on behalf of is a Senate bill to stop juveniles from being transferred to adult county jails. And this is something that's near and dear to my heart. I've watched children literally get transferred to the men's county jail and become crushed and victimized because of a system that just doesn't humanize our youth. And so I had to make sure that our voice was heard, that the children's voice was heard, so that we could change this. But I'm here now.
No problem at all. And thank you so much for joining us, and we'll let you take it away.
Okay, so I apologize, Miss. So first, some of what I've been hearing in terms of what's going on inside of the system. So I get quite a few letters and phone calls. I actually have stacks of letters that I'm in the process of answering right now. People are scared, both men and women that are in these institutions, especially in the state of California. We just had our 6th death yesterday in the California Institution for Men. I've heard 2 different sides to this. One side I've heard is that in many institutions, the wardens and the staff are doing everything they can possibly do to make sure that people have PPEs, that they're cleaning, they're making sure that people are practicing social distancing, that correctional officers are wearing masks, but I've also heard the opposite too. So I've heard a bit of both, and I think that comes down to the leadership of each institution. For long-termers that are currently incarcerated or people that are serving a life sentence, I hear a lot of fear, but the other thing that I've heard that impresses me always deeply is the compassion of the worry about people out here. On a number of different times, a number of different occasions, either via mail or phone calls, people want to know that we're okay, that ARC is okay, that their families are okay, that everything's okay out here because they see the news. That speaks volumes to the people that are currently incarcerated, because though they're in a place, one of the worst circumstances, they're still worried about if everybody outside is okay. In terms of what we've been doing at ARC for advocacy around long sentences, we've passed a number of different Senate bills, including Senate Bill 394, which we passed a couple of years ago, that eliminated life without the possibility of parole for people who had committed their crimes as juveniles. We also passed Senate Bill 260 and 261, which allowed people who had committed their crimes before their 21st birthday to be considered, their youthful age to be considered during that parole hearing. We also co-sponsored a bill called 1437, which pretty much did away or now applies to the, I'm sorry, I still have this phone. Let me turn this down. Uh, 1437 basically applies to The I'm sorry, mine is going so many different places. The felony murder rule, which basically in California for many, many years, if a person was not the trigger person or the person who actually committed the crime, and they were with the person afterwards, during, they would basically get sentenced to the same amount of time, possibly even more. And so what 1437 did was put in the application, basically the culpability of the individual was based on what they actually did. So it eliminated almost many people who were sentenced under the felony murder rule. So we co-sponsored that bill. We're currently working on bills that also work, that are looking at LWOP and how do we change life without the possibility of parole. So we're actively involved in that. As you know, I'm a former life prisoner, so this is also something that's very near and dear to my heart. The third question that I was asked was based on my experience and many of the people that I know, that I work with, that I've helped come home, how are we able to rehabilitate ourselves inside from serious crime despite the shortcomings of what prison offers in terms of rehabilitation? So a couple of things I'd like to share. The Anti-Recidivism Coalition, 70% of our staff are formerly incarcerated. So literally more than half of us have done prison time. Many of us are former life prisoners. The Hope and Redemption team is a team of former life prisoners that go back inside and run rehabilitative programs inside now 9 prisons. And so what we did in the late 90s and in the 2000s, we started realizing when we really wanted to change that there were not tools for us to do this. We wrote to people, we wrote to organizations, we wrote to family members, and literally took books and started creating our own curriculums, everything from anger management to understanding how to navigate your emotions. And so as different individuals who at one time or another may have been leaders of gangs became leaders of rehabilitation on prison yards. So literally in many instances, including places like San Quentin, Soledad, Old Folsom, you started getting these oases, as I would describe it, of rehabilitative programming that was created by people that were inside. Eventually, in the past 10 years, many lifers began to come home for a number of different reasons. One of the main reasons is a California Supreme Court ruling under Henry Lawrence, but also Governor Brown. While Governor Brown was in office, he released over 5,500 life prisoners or former life prisoners. Those same life prisoners today, which the numbers are now, I believe, at over 6,000 under Governor Newsom, have a less than 1% recidivism rate. And this is clearly reflective of the rehabilitative programming that's available, that we've created, now that's actually being brought back in by former lifers and people that really understand the system. If we go back a little bit and just look historically at our prison system, at one time we actually did have, many years ago, a lower recidivism rate when there were programs available. And then what happened? Politics, tough on crime, a lot of false narratives of having youth that were considered super predators and things of that nature. The war on drugs that was created, all these different things happened. And we started saying, instead of having rehabilitative programs, we need to do punishment. We're back at the point where we understand that punishment does not work. And if we look at it from a global perspective, even during this pandemic, the same way this is affecting everybody around the world, look at how prison systems in places like Norway actually work, where the goal is not punitive and punishment, but the goal is rehabilitation and to introduce a person back into society whole. So I would hope that people that are listening to this understand, or that don't believe in rehabilitation, understand that as a life prisoner, as a teenager that committed a horrible crime, I changed while I was inside, and I came home, and I've been doing this work the entire time that I've been home. I've been giving back every day of my life, and I'm not unique. I'm not a unicorn. There are thousands and thousands of others just like me that we just don't see, that are giving back to their communities every single day, making our communities safer, better, and whole.
Thank you very much, Sam. Really appreciate that, and you're taking the time to join us today. Morgan, my colleague Morgan, is going to go through some of the questions we've been receiving for you all to respond to, and I'll try to help address them as well.
Thank you.
So the first question, a couple people have asked this, what are some effective lines of argumentation for the decarceration of people with violent convictions when key decision makers appear to be driven more by fear of political backlash than by public health concerns or data about recidivism and threats to public safety?
So from my perspective, I'd rather have, so for political leaders, here's the thing. Advocates need to unite and push our political leaders to make the right choices, not the politically right choices, but the right choices, the choices that are based on humanity. Oftentimes, we're not going to get those choices because many of our electeds are thinking about the next election, the next office, the next higher office. However, when we find those champions, and we have many in the state of California, that believe in the humanity of human beings that are incarcerated, we need to also support them and get behind them. Meaning when it's time for them to be reelected, we make sure that they get reelected and we make sure that they're supported. And for those that don't support the humanity of people that are incarcerated, we need to do the same thing, hold them accountable. Ultimately, it's gonna come down to the ballot. That's where people start believing that if I do the right thing, I'll have the support. But if we don't do the right thing and people get voted out, as a politician, I'm gonna do what was politically best for me to be able to survive. But if I have the will of the people behind me and know that all I have to do is the right thing and the people will always rally behind me, that's gonna always be the key, at least from my perspective, from what I see in California.
I think it's the right question because it's really, really hard, right? And I think there's a reason, like we haven't seen basically any state comprehensively kind of do the right thing in this situation. We've seen some local officials and some particular institutions release a bunch of people, mostly jails and not prisons. We've seen some prosecutors stop asking for money bail, but we have not seen really comprehensive action in any state, and particularly on violent crime prisoners, right? Because that is the kind of the third rail in this in the political debate about anything related to criminal justice reform. I think that getting the research before them is important. I think that having people, this is part of the reason that I think it is important to emphasize in the current coronavirus situation, the risks that are posed to people outside prison, as well as to staff who I think are first of all, genuinely at huge risk here. And that's like a population that we should care about, right? Like the same way that low-paid essential workers throughout our society are bearing the brunt of this crisis. Prison workers are among those low-paid essential workers who are in a very dangerous situation. And in many situations with criminal justice reform, prison workers have been opposed to the interests of people who are incarcerated, right? Because I think they see systematic criminal justice reform as a potential threat to their jobs in the long run. But in protecting everybody who spends time, whether it's their work time or their sentence time behind bars, their interests are aligned, and we ought to be able to take steps to protect all of them. But I think getting people to realize that the risk to others besides incarcerated people is greater from leaving people behind bars than it is from letting them out. I think that's like a thing to try to try to make clear as much as possible. I also think in practice, at least in places where there are sympathetic corrections officials, maybe judges, et cetera, to some extent, these decisions there could be made with people who are a little bit more insulated from elected politics, right? And so a governor could maybe give authority to corrections officials to make release decisions as opposed to ordering them. I think governors really should just order them, but if they're not willing to do that, if they can at least give discretion to allow those kinds of decisions to be made by people who are not standing for re-election, then maybe that has a more plausible chance of actually happening.
Great. The next question, in Massachusetts, it appears that the infection rate is fairly low, and we have had 8 deaths among about 13,500 incarcerated people. The corrections community says that this is evidence that the prisons are safe and we don't need decarceration to save lives in prison or in the community. Are they correct, or will there be an explosion of infections and death down the road?
I can take that one, Morgan, if you want me.
Mm-hmm.
So I think that that may be moving between medical, public health, and what I've learned from attorneys and the detainees is that I think I want to emphasize these deaths, even if they're 2, 4, 8, however number, these deaths are preventable. They're preventable, and most importantly, if we use the concept of social justice, health inequity, whatever framework we want to use, moral economy of life, political economy of health, they're unfair. They're remediable. They're part of these remediable injustices, as Sam explained. And thank you, Sam and Sonja, for your wonderful presentations. I think that we need to make that clear. It's not especially for the community or the physicians particularly, or the medical staff, to be judging people. We need to be protecting them, And the second thing is, with this pandemic, no one is safe until everybody's safe. And that's what they need to understand. And I think, looking at these numbers per se, there's 2 things to remember. One, I think, if you remember at the beginning of the pandemic in the US and in the world, people talk about the peak and flattening the curve and so on. I think we haven't seen even the end of this peak in these jails. So just having 2 deaths, 4 deaths, that is a lot. That is unexpected, number one. And number 2, I'm sure, unfortunately, and I hope I'm wrong, that we will see many more deaths down the road. As a matter of fact, I just got a text message of another death in a local jail that I participated. And it's just disturbing to me, because some of these people don't have the $200 to pay for the release, or they're not criminals, point, period. So the thing I would like to make is that we don't know where this pandemic is going, particularly inside those places, because there's a lot of under-testing, under-reporting, and the real numbers are probably very different. And unfortunately, as I said, I'm sorry to be redundant, I hope I'm wrong, but I think we're just seeing the beginning of a larger problem. And that may have to do with a bigger issue, which the US has the largest number of people in these correctional facilities. And it's not a coincidence that we're seeing all these problems compared to other places. Iran released 70,000 to 100,000 people at the peak of the pandemic. And that probably had a significant impact, not only in protecting the people inside correctional facilities, but also in protecting the larger community, because this is a 2-way street. The people, my point being, is public health inside prisons is public health in the larger community, and we should think about it in the same way.
I'd like to.
Oh, go ahead.
Morgan, thank you. So, as Carlos said, first of all, if it's 1 death or 20, it's a human being. A person died a preventable death. For us to say, well, only a few were doing a great job. So what you're telling me is that a human life doesn't mean anything to you as long as it's not a lot, or it's not someone that's close to you. I mean, at least that's how it can be interpreted. So a couple of things need to happen, in my opinion. When corrections officials say that, we need to immediately say, okay, they're appointed by the governor, let's hold them accountable. Again, it goes back to us holding them accountable. And then when we take into consideration when a person is incarcerated constitutionally, it's our responsibility, it's the state's responsibility to make sure that that person has constitutionally adequate medical care. And if in society we're saying that we have to social distance, we need to provide a way for people that are incarcerated to be able to social distance to be able to get through this. If not, then we're failing them constitutionally, and people need to be held accountable for that. So if 5 people die, if I get in a car right now and cause of five people to die in a car, I will be held accountable for that. Who's going to be held accountable for the deaths that are occurring in our facility? Because those are human beings that are dying. Those are sisters, brothers, mothers, fathers that are dying. And when we start asking about accountability and really pushing that line, then you start having electeds that want to do something different. I'd like to also add, like, and the Citizen Project is part of this, and many other organizations across the United States are part of the hashtag We Matter Too campaign. It's a national campaign to really push electeds, governors, local officials to de-incarcerate to levels where people inside can social distance and they can be safe.
Yeah, I would add so first of all, we don't really know the scope of what's happening because we don't have testing, right? And also what we don't know, like by the time positive tests start coming in, there usually will have been a week to 2 weeks of transmission going on, right? That's true in the outside community. It's also true behind bars. And because the reproductive rate is going to be a lot faster behind bars, that will often mean that it will have basically spread to everybody before you start detecting it in anybody. I think when you look at the aggregate numbers across all corrections facilities, I think, again, the good news that you're seeing is that it isn't too late to it isn't already too late to take steps to protect a lot of people, right? If it were the case that COVID had already swept through all jails and prisons in the US, then we might be saying, well, you can't actually protect people by taking people out or now they're immune, et cetera. That isn't true, right? There are still plenty of facilities where we can still protect them. It is the case, though, that some facilities have been among the very biggest kind of super spreader sites in the United States. So I saw at some point 7 out of 10 or 8 out of 10 of the top sites for spread in the US had been prison and jail facilities. Basically, once it gets into particular facilities, it will spread quickly, right? And so, so what we're seeing is huge amounts of spread, especially in jails that are in areas that were early coronavirus hotspots, right? So Rikers Island, the Cook County Jail, so far, and so that's where the virus in society spread, and so there's more entry points there, right? And Carlos is the epidemiologist; he can correct me if I'm saying anything wrong here. But what I would anticipate is, as the virus spreads to more places, and particularly to the rural communities where many prisons are located, where it didn't really start, but where you know, in the public health experts more broadly are predicting more kind of geographic diversification of where the of where the virus is, especially as states begin to open up and there becomes higher risk in communities that have otherwise had a low rate. Then we're going to see more potential entry points into other facilities, and then each one that it gets into, it's likely to spread rapidly. And so that's why we've got a window where we can still act now to protect people.
The next question regarding Sonja's research: does the recidivism rate of older incarcerated people depend at all on how many years they've already spent in prison?
So yes, so the rate that I gave was was overall for people released. with all lengths of stays. The rate is lower for people who have been incarcerated. When you look at older people specifically, I don't have the exact numbers in my head, but the rate is lower if you look at people who have been incarcerated for 5 or more years. But a lot of them have been incarcerated for way longer than that. So that's actually not a very demanding cutoff point when it comes to older prisoners. And that's basically because of the research on kind of the criminological age patterns in crime, like people who commit crimes, especially violent crimes, when they are young. Those are often kind of crimes of youth, right? They are crimes of often having, just not quite developed a level of control that older people tend to develop, and people somebody who has committed a violent crime at that age tends not to be dangerous, 5 or 10 or 20 or 30 years later.
The next question for Dr. Franco. I noticed the CDC's figures for prison cases and deaths were much lower. Can you comment on that?
Yeah. I'll try to be polite. I think the issue is that, that there's been a lot of resistance to, for example, I spoke about the guidelines, the CDC guidelines on, I think the number one issue is that the CDC, in my opinion, and it's not my opinion, I think everybody would agree, need to come out strongly or stronger in promoting depopulating jails. Because that's, what I can tell you is I mentioned, is depopulating jails and prisons is the only meaningful way to achieve social distancing. Jail or incarceration in general is the antithesis of social distancing, period. I think, washing your hands, soap, wearing a mask, and so on. That's important. I'm not saying it's not, but it's highly insufficient unless you achieve social distancing. And we know that because that's what we're seeing now in the inner cities, in the bigger urban settings, is the impact of that social distancing in reducing the spread and preventing, or like flattening the curve, basically. So in jails, the only way to do it, honestly, and jails and prisons, is to flatten the curve. And the CDC has not come out for obviously political reasons. They've been silenced significantly. I would say that. However, it's their main role. Public health protection, and as Sam pointed out, it's a constitutional mandate to protect these individuals, and these are the most neglected individuals that I've seen, in my life, in my professional experience, in all senses, all senses. But medically, they're so vulnerable, and there's so much fear, and it's just simply unacceptable and unfair. So I come out, as I said, politely to CDC and state officers that work, in collaboration with CDC, to please do something more, because we need them. They have the leverage. We in the universities or in the advocacy groups, we do have limited power compared to what they have. So talking about really, like head to toe in a bunk bed where there's 8 people in a room, that's not social distancing. Providing soap is not social distancing, man. So if you really want to protect these individuals, please release them, release and protect those that are medically vulnerable, because it's the right thing to do, period. The second thing about the numbers, I don't know, but I think, I think it's just they haven't been paying much attention until recently to these numbers. And the UCLA Behind the Bars COVID Data Project, the Marshall Project, and many other groups are collecting this data. We know these numbers are real because, just to give an example, Sterling Prison in Colorado, at the point where they had 2 or 4 cases similar to Marion, Ohio, once you have 2 or 4 cases in a jail where there's more than 1,000 individuals, there's this modeling, mathematical modeling that can tell you more in a more precise ways of what I'm telling you. But there's probably 300, 500 people infected. So what we see in some of these places is the tip of the iceberg of a larger number of cases. And again, my impression by talking even to some of the CDC officials is that they're in a coma train, basically. You know, I hate to say that because the testing and the screening and then the temperature checks have been largely insufficient, and in some settings, and I can prove this by the a declaration, is that they have actually provided this over-reliance and this false information, basically, to jail officials to hide behind that and promote by moving somebody who's on quarantine without testing them to a place where there's individuals that are medically vulnerable without testing or trying to do some effort besides just checking their temperature and asking them, are you okay? You know, it's unfair and it's promoting the spread of the disease. So I think there's need more attention by the CDC and the state officers from a public health perspective to these institutions, because these are preventable deaths, preventable cases in many cases. So I think the CDC is really behind with correctional facilities.
Morgan, I don't know if I missed this while I was away. Did anyone speak to the transition of people that are incarcerated as we decarcerate and bring people back into the community, the solutions that are available or the actions that have been being taken?
No, but Sammy, if I may say one thing, you said from if they're being released, what happens, like to protect them? No,
so I've gotten this question many times in terms of, okay, so California let out 3,500 people, and they did it in a week. A lot of people didn't realize they literally did it in 7 days. But there was a coordinated effort of statewide community-based organizations, probation, and CDCR with communication through the governor's office. So those people were provided transportations from the institutions they were released from. We were able to get the day that they were released, where they were going to, transported them there if they had special needs, made sure that they had PPEs when they were put in the cars, and transported them to their living facilities, whether it was transitional housing or to family. That went without a hiccup. It was literally maybe 2 people that had to catch the bus that I personally know of. But the point is that communication, that coordination between community-based organizations, the Department of Corrections, and the governor's office is what allowed that number of people to be released in 7 days. If you think about it, 3,500 people. And the second phase of that, which is now started last week, is literally giving them cash assistance as long as they're connected with a community-based organization where they're programming, so to speak. So you have to have so many hours of being involved in programming. It's got to be documented, and then each month you're given money. And this was done by a collaboration through the community, through CEO. CEO is Community for Employment Opportunities. And so Center for Employment Opportunities, I'm sorry. And so in collaboration with them and a bunch of other community-based organizations and a group of foundations, a chunk of money was put together to be able to be issued out to the people that were just released. And so it was not just given out willy-nilly. They literally have to be plugged into programming in order to make sure that there's not an uptick in crime. And so this model works. I know we're in hard economic times, but if we're serious about this, if this model worked in 7 days with 3,500 people, how do we scale that up with government support and foundation support?
Thank you, Sam.
Go ahead. Thanks, Morgan. And Carlos, did you want to add anything related to that?
No, thank you.
Okay, well then I'm just going to wrap up now. We're at the end of our time. Thank you so much to Sam, Carlos, Sonja. Thank you, Morgan, for helping with moderating the discussion. Thanks to our very engaged audience. There is pretty much an army behind everybody you see here making the same points with plenty of evidence to back up the points that have been made here. Criminologists, medical professionals, advocates, and formerly incarcerated people. We appreciate all of you joining us today, and we will all be continuing our work to spread this information and spread the message so that we can have the right response that we need from correctional facilities in response to this pandemic. Thank you, everyone.
Thank you so much for having us.
Thank you, Nazgol and Morgan.